Sure thing. I'm going to mute now.
Perfect. All right, good afternoon, everyone, and thank you for joining today's town hall. This should be short and sweet, and today I have with me the Director of Emergency Management, Jason Stogner. So first on our agenda is an update on Brown Residence Hall. So last week, our Student Health Services tested a large batch of residents after confirming several cases of COVID-19. So we're happy to report that no other students in that specific group tested positive for the virus, and all the residents placed under quarantine have since been released from their quarantine status and are free to move about campus as usual. So the campus community was notified of their clearance yesterday via email. You should have seen that come through your inbox. And next, we'd like to talk with you a little bit about our dashboard and some of the reporting procedures and processes around that. For that, I'm going to turn it over to Jason.
Thank you, Sarah, and good afternoon, everyone. Happy Friday Eve. We continue to receive a lot of feedback and suggestions and questions surrounding our campus dashboard and our positive case reports. I want to remind everyone that we have actively listened to your concerns and your suggestions. We've taken all that in consideration and want to share that our dashboard is in the process of being updated to a format that we think will be more transparent and will show you the case data in a day-by-day format. Again, that'll be easier to read and understand. You should see this change over the next week. The goal of the new dashboard is to make sure we address all of the feedback we have received and to help our campus community understand where the data is coming from and really what it means. What we do not want to do is to interpret the data to fit or justify any narrative. So again, our goal is to be as transparent as possible. There are a couple of things that we would like to offer some clarity on. So first, administering a test does not automatically equate to a positive case on the dashboard. The test results must be received, which typically takes anywhere from 2 to 3 days on average, and before we can place them on the dashboard. So keep in mind that the reporting is not an instantaneous process from the moment an individual gets tested to when a case may appear on the dashboard. It takes time, not only the test results coming in, but then also contact tracing. Secondly, the cases that look like they could lead to a cluster or cases that could be considered a concentration per se of cases may not appear all at once on the dashboard, as in a sudden rise in multiple cases. So we saw this with the situation in Brown Residence Hall. With the cases on the second floor of Brown, contact tracing completed by Student Health Services was able to identify any links between positive cases. These are what we call epidemiological links, and that's critical when it comes to contact tracing. And what this means is that the cases are related to each other and suggest that direct disease transmission between two individuals exists. So these links help identify others who may have been exposed or may need to be quarantined and tested. And this is, again, what we did with Brown. Seeing 1 to 2 cases related to each other within a couple of days, especially in dorm-style living, is obviously expected. Further, pending test results, exposures that test negative or negative screening tests are not listed in our case count, as these are not positive cases. Lastly, please remember that if cases are not self-reported, we do not know about them, and we won't know about them, and they will not appear on the dashboard. We can only report cases that we know about. So continue to encourage students to please report to Student Health Services. Thanks, Sarah.
Thanks, Jason. So y'all, please be on the lookout for that dashboard change in the coming week or so. We really think it'll be helpful in understanding some of the data and the cases that have been appearing. So next, we're going to take a moment just to talk about some Student Health Services procedures. This also helps us understand the data a little bit better. Student Health is available for the diagnostic testing of COVID-19, and they've implemented a call first policy. So students that present to their faculty members with concerns about testing should be directed to Student Health Services. They can't really make a provider designation or decision if they haven't talked to the student. So on our campus, they really are the very best resource for accurate testing information, exposure guidance, and they're happy to guide the student through that process. Please remember that the providers within Student Health are assessing our students, and they're doing that through their own medical training, their education, and through guidance from DHHS and local health departments. So they have also begun a small amount of surveillance testing, and we expect to see an increase in that testing as the semester progresses. So it's important to go ahead and refer any student that is coming to you with questions, or colleagues or anything like that. Go to Student Health Services. That really is the best resource that we can point them to, because they are trained and equipped to handle those questions and can provide that provider guidance. So on that note, there's really no doubt that living and working and learning all throughout COVID-19 has not only been a really long process, but it's taken a toll on people and their mental health. We want to remind you to reach out to the Health Center's counseling services, who are here to support students, faculty, and staff who are experiencing any stress or discomfort. For this reason, they've set up COVID-19 specific sessions, so you can reach out to them by calling or scheduling an appointment online. We encourage you to also share this information with your colleagues and any students you come in contact with, but they're really there to help and make sure that in this long time of dealing with something that a lot of us have maybe never dealt with before, they're there for us. So make sure that if you are seeking that guidance, you reach out to them. We also want to take a moment to address any stigmatization around COVID-19. So stigma about the virus is associated with a lack of knowledge about how the virus spreads, a need to blame, or fears about disease and the death it could cause. So this also goes in play the gossip that spreads rumors and myths. So stigma hurts everyone by creating fear or anger towards people and human beings instead of the virus that's causing some of the problems. So please remember, and we can't stress this enough, find factual information and don't stigmatize others based on any incorrect or misinformation. So it's just something that we have seen lately. We've seen it a lot as we have responded to COVID-19. We know this is a difficult time, but please keep in mind finding good information and making those facts known instead of any misinformation that can lead to a stigma. So with that being said, we do have a reminder about the flu vaccination clinic.
Yes, Sarah. And so I know you've heard us talk about COVID-19 and the pandemic, but we've got to make sure that people remember there's other things that exist and other risks that we have to deal with, including traditional influenza and the traditional flu season. And this year, since we're in the midst of a COVID-19 pandemic, getting a flu shot is even more critical to your health and wellness. So we just want to remind people about that. The CDC recommends getting a flu vaccine in September or October so that you'll be protected as the flu season starts. And today, from 1 p.m. until 4 p.m., again, 1 to 4, Student Health Services is operating a no-cost flu vaccination clinic at the Anderson Center. Again, no cost. Flu vaccines will be available first come, first serve, and you need to bring RAM card and insurance card. But please remember that the flu shot is not just about protecting you, but also other people that you could potentially pass the flu on to. It takes about 2 weeks for your body to develop antibodies to the flu after receiving the vaccine, and you cannot get the flu from the vaccine itself. I know that's often a myth or misconception that you'll typically hear. It's very important that you do not leave yourself unprotected from the flu this year. It's really critical. If you are unable to make today's flu shot clinic, we urge that you make sure you get a vaccination either from your primary care provider, the doctor you traditionally see, your local health department, or pharmacy, CVS, or anyone in your neighborhood. So thanks, Sarah.
Awesome, Jason, you make a great point. That's going to be increasingly important as we move throughout the season. So lastly, don't forget, we have another scheduled community testing event for COVID-19 testing. So we had one on Tuesday evening, and then another one is scheduled for Saturday from 9 a.m. until 12 noon at the Anderson Center lower parking lot. It's a drive-through clinic, but walk-ups are also accepted. You can pre-register for the event, and there's no cost for the COVID-19 test. So we encourage you to go ahead and take advantage of the community testing opportunity and look forward to scheduling more in the future. So these aren't just going to be this one time. We're hoping to get some more. We are in a collaboration with the health department on that. So more information is available in the campus announcements that were sent on Wednesday to campus, and then future dates for any of these testing sites will be communicated once they are finalized. So one of the questions we have gone ahead and gotten is, can we bring our children to the flu clinic? I don't think so, but you can bring them to the COVID-19 clinic. But I know that children sometimes are more comfortable getting theirs from their normal pediatrician or healthcare provider. So if you cannot do it to the flu clinic, then you can take them there. The flu clinic is for faculty, staff, and students only at this time. If any other flu clinics are scheduled in the future, we'll make sure that you know about them. All right, that is the only other question that we've gotten. So we want to make sure we give you some time back today, and we thank you for joining us. And remember to please follow our campus community standards, remain socially distanced, wear your mask, wash your hands. Let us know if you have questions or if you need anything. Have a great afternoon, everyone.